All right, why don't we go ahead and get started? My name is Mark Schwartz, and I am the director at Harmony Place, Monterey, as you can see. And my background is in psychology, and I formerly was with Masters and Johnson in St. Louis, and directed Castlewood Treatment Center for Eating Disorders. And now we run a partial hospitalization in Monterey. People come from all over with 3 different tracks, one for eating disorder, one for mental health, and one for chemical dependency. And we do a lot of work with comorbidity. Okay, so let's move on. Let's go to the first slide. And we'll tell you what sort of stimulated this webinar, which was that I was working with a client recently who was having multiple affairs, and his wife was ready to divorce. And as I was working with him, he said in that first session, "I don't think I know how to love." He says, "I don't know if I've ever been able to love my wife or even my kids. There's something sort of missing there." And it occurred to me that maybe what he was saying was really something that maybe I had missed, which was that it's like some people, we ask them to speak a foreign language, like Portuguese, and you put pressure on them, they still can't speak Portuguese. And that some people don't have the language to be able to love. I had another client who was having multiple affairs with prostitutes, and he apologized to his partner, and I felt like there was something missing in the apology. It was sort of from his head, but not from his heart. And I realized that there's something in empathy that's so critical that the person wasn't able to tap into. So as I did the work with him, I sort of watched what I did and try to record it in my mind. And in each case, we were able to be successful in changing that around. And so what this workshop is it's my attempt to sort of conceptualize exactly what it is that needs to be done in order to be able to treat people who have primary problems with intimacy and receiving love. It's broader than just sexual addiction, but more people who have intimacy disorder. Okay, so I took this off the internet, and it just is a reminder that there are 28,000 people looking at pornography per second these days, and 2.5 million people every second are logging into a pornography website. And, sometimes there's an elephant in the living room and we don't notice it until 10 years later, but there's something going on here. And it's worthy of asking ourselves, what are the implications of it? Because I think it's a structural change that's occurring in people's minds. What I want to talk about is, what is this thing called love? And what is a person who has an intimacy disorder? And what is a deficit in love? And just a way of thinking about this, I thought I would read to you something that always struck out for me on this question. If you've ever seen the movie Nuts, Barbara Streisand was Claudia, and she was undergoing a psychiatric examination in court, and her parents were in the audience. And this is what she said to her mother, who just said, "I love you, Claudia." And here's what Barbara Streisand said: "When I was a little girl, I used to say to her, 'I love you to the moon and down again, and to the world and back again.' And she used to say to me, 'I love you too, to the sun and down again, and the stars and back again.' You remember, Mama?" I used to think, wow, I love Mama, Mama loves me, and what can go wrong? What went wrong, Mama? I love you and you love me, and what went wrong? Now, she had been incested by her father for a number of years, and her mom knew about it. Barbara Streisand said, "You see, I know she loves me, and I know I love her, and so what? She's over there, and I'm over here. She hates me because of the things I've done to her, and I hate her because of the things that she's done to me." You stand up there asking, "Do you love your daughter?" And they say yes, and you think you've asked something real, and they think they've said something real. You think because you throw the word love around like a frisbee, we're all going to get warm and runny. No. Something happens to some people. They love you so much, they stop noticing you're there because they're so busy loving you. They love you so much, their love is like a gun, and they fire it straight into your head. They love you so much, you go right into the hospital. Yet I know my mom loves me. Mama, I know you love me. I know the one thing you learn when you grow up is that love is not enough. It's too much and it's not enough. Anyway, I hope that touches you in the way that touches me, because every day I listen to clients coming into my office struggling with, do they love their parents? Do their parents love them? And there's this idea that when we use the word love, that we know what the other person's talking about. And yet I think somehow that we don't. So I want to struggle with the definition of love, because I'm saying that a large number of people who come in to see me don't have the capacity to love. And the question is why, and what do we do about it? And how do we implant this capacity to love? There's a famous book called Receiving Love. And in that book, there's this idea that there are some people who are unable to allow themselves to be loved. They hate themselves so much that they block people from loving. And the question is, how do you unblock your capacity to love in some ways? So here's what I'm saying. I'm saying that our clients have intimacy disorders and that they're injured in their capacity to love and be loved. And our job is primarily to repair that. And I want to talk in this workshop about how one does that. Okay, that's my introduction. Let's go. So the first concept that I want to try to put into the understanding is that of disorganized attachment. I think some of you know from my previous webinars that when I was at Johns Hopkins, Bowlby came in for a while, and his book on separation had just been published, and Mary Ainsworth was there. And so in a very young age, I was turned on to attachment theory. And I felt like disorganized attachment was the conceptual model for understanding intimacy disorder, and pulled together so many of the psychodynamic and object relations ideas. So in this slide, I lay out sort of the fundamental, which is that the basic problem is that some people get fixated in the psychodynamic language as children at a young age. They get stuck in the trauma literature at T-1, or they begin to somehow regress back to a young age, where on one hand, they want to fuse with their parents and be one because they feel so alone. And the other hand, they want to separate from their parents because that's the natural unfolding developmentally. And in that separation individuation process, there's an injury. And so what happens then is that they get stuck at that approach avoidance stage, and a lot of them are fused with their caretakers. And what happens in that is that as they're fused with their caretakers, that they find themselves over concerned with trying to take care of their parents, trying to succeed in order to get their parents to notice them, trying to be able to look for their parents' approval that they never were able to get as a kid, that all that conditional love stuff or taking care of the parents stuff gets sort of floated into this. And so their life becomes sort of dedicated to trying to get something they never got long ago. And even if their parents are dead, they're stuck with that in some ways. And then what happens is they project that upon their partner, and they find themselves moving into relationships where they're basically trying to take care of their partner. They lose themselves in that process. They become fused in some way so that they become dependent upon their partner. And there's this fear that their partner is going to leave them somehow or abandon them. And so they have to do everything possible. And we call that otherization. Otherization is that their life is devoted to not disappointing others, to pleasing others at the cost of themselves. Okay, so in this place, they stay relatively immature. And what happens is that they then oftentimes find a partner who's equally immature and form a dysfunctional relationship. What we see is that two undifferentiated people come together and form a glob of dependency. Now, in that, there's this desperate need to come together because they feel so alone and trying to get finished in some ways, and an equal need to separate. Now, that's, to me, is the fundamental basis of disorganized attachment. Disorganized attachment is a pattern whereby a person's history is one where when they bonded with their caretaker, they also got punished in some way. And so there was the combination of moving towards and moving away simultaneously. And so reasons why they end up having affairs is because they're terrified of being fused and have to push themselves away, and terrified of being abandoned and therefore have to cling. And so it's sort of moving back and forth between the two of them. Okay, so I think you got the paradigm that I'm getting to, the pattern of disorganized attachment, moving towards, moving away, and that really these symptoms are functional. Now, if I'm right about this, here's what I think. When I used to run an eating disorder clinic, what I realized after years and years of working with eating disorder clients is that eating disorder is not principally about food. It's about fears of intimacy. And after working with sexual compulsivity for a long period of time, I come to believe that sexual compulsivity is not that much about sex. It's far more about intimacy and the ambivalence of intimacy. And if I'm right, then the overemphasis on abstinence or on being able to talk about sex or sexuality needs to be replaced with trying to help a person develop what we call earned secure attachment, which is the ability to form intimate relationships with other people. And so that's what I want to talk to you about, because to me, there's a whole formula for establishing earned secure attachment, and it's that which is necessary. I think that a lot of people who are treated for sexual addiction in 12-step groups are what we may refer to as dry drunk. They stop their behaviors. They don't relapse on their sexual addiction, but they're dry drunk in the sense that then they're left with the inability to establish intimacy with anybody. So where I start is with Brown and Elliott's book on adult attachment. And of course, they come up with this idea of what they call the ideal parent paradigm. And I love that idea because in it, there was this idea of implanting in the mind of the individual what is secure attachment. And so their criteria, which is felt safety. The clients who come in, they feel hollow, they feel empty, even when they're with people, feeling seen and known, feeling self-acceptance, that knowing that all that shame stuff that you've been indoctrinated with is basically a lie. Felt comfort in the being able to receive love, feeling valued and noticing what you do right rather than what you do wrong, and being one's unique best self. So I love these criteria. And what I'm saying to you is that most people don't have the frame of reference of what is secure attachment. And so in the ideal parent work, what the idea is somehow to begin to implant in the mind the capacity to understand secure attachment. And in our model treatment, what we're trying to do is develop a secure attachment with self. Now, what that means is that an earned secure attachment with self is that you have an observing mind of the individual that's capable of reparenting the injured parts of self. So whether they're baby parts or adolescent parts, these are injured parts. And the adult self, in the capital S in Richard Schwartz's idea, is reparenting these injured parts. And so when a person says, I feel like I'm defective, I feel like I'm ugly, I feel like I'm fat, I feel like I'm stupid, I feel like I'm defective, that the adult self is able to hear that and be able to correct that and be able to say, it's understandable that you feel that way. However, it is untrue, and the truth is. And so that felt defectiveness that comes with shame there's a corrective emotional experience, so to speak. And so we have to begin to understand that with disorganized attachment comes a form of dissociation whereby parts of self split off, and you can know you're smart and feel like you're stupid. You can know you're not defective, but feel defective. And so what one is doing is beginning to correct the deep structures in that process. Now, so often the therapist would be in that role of being able to say, well, you're not stupid, you're not defective, you're not bad. But the client would be unable to receive that and repel it in some way and feel scared, like the therapist doesn't see them or know them. So what one has to do is begin to have the person do what Dick Schwartz calls self-healing. And that's the model we're talking about. It's more of a Gestalt model of beginning to have the self begin to heal the injuries of the child. In this, the idea is that if a parent is having conditional love, who's highly disciplined, who punishes the child regularly, or the parent, let's say, is sick or defective in some way physically, that the child begins to take care of the parent. And in that process, they become enmeshed, and the child's always looking to avoid the punishment or the discipline, or the parent is beginning to glob on and use the child in a way to take care of them. And in that, you create what has been called in the object relations literature the false self. And the false self is what we're seeing most consistently is kind of like a duckling looking for someone to be able to bond to. Will you take care of me? Will you be there for me? Will you not abandon me? And that preoccupied attachment, love me, love me, love me, love me. But since they have also avoidant attachment, then they have a high dependency, and then whenever they get close, they get terrified and get pushed away. And so that false self is running around looking for someone to finish them in some way. What we're trying to do is what Masterson used to call the development of the real self. And the real self would be what Murray Bohm would call differentiated. And really what we're talking about in today's language is launching. Launching means that you're now an adult. And what is an adult? Adult, somebody who can stand alone, who has an I, who feels strong and powerful and competent alone. But the problem is that a lot of people who launch in that way, when they find themselves getting into a relationship, they almost regress back and become part of someone else and can't hold on to the self. So we're looking for is what's necessary for a person to have a self and hold on to it when they get into a committed relationship. So now we turn to what happens with sex addiction. With sex addiction, the person moves into a relationship and they feel utterly defective in some way. They feel like in this picture slide, somehow that a person can see, I feel my shame exposed. I feel defective in some core kind of way. Now let's think about this. How many women use sex as a way of, listen, I don't really enjoy my sex life with my partner, but I need to satisfy my partner. I need to keep my partner. I know they'll leave me if I don't have sex with them. So I'll do it out of obligation, out of fear of abandonment. Or some females, for example, use seduction as a way of being able to feel powerful and in control. They don't like their bodies, they don't like sex, but they seduce in order to feel powerful and in control. That's what female sex addiction is so much about. Now, is that so far from male sex addiction? The number of people who have sex with me, I can put marks on the wall, whether homosexual or heterosexual, and my power and control comes from the other wanting me. And so often with this behavior of people going online and getting, one trick after the other sexually, it's because they feel empty and powerless. And for a moment that their cup gets filled. So I always thought of it as a cup that doesn't have a bottom on it. So you have a trick and then you feel competent, powerful, and in control. And then so quickly it drops out the bottom and you feel weak and defective again and need to have another one, which makes it an addictive cycle. And so what I'm suggesting to you is that maybe this sex addiction is not the subset of people who go to 12-step programs, but that it's endemic in our culture. How many women, the statistics say that inhibited sexual desire among women who go into a gynecologist's offices, 1 out of 3 women say they don't enjoy sex with their husbands. And I think those data are fairly reliable. So they're servicing their partner. And in some ways, anybody who services the partner, I think I would qualify as a sex addict. And so many people are using sex as a way of out of obligation in some sort of way. So I'm thinking about this in a much broader context than the small subset of people who go to SA or SLAA and feel addictive cycles. I just think that there's so many people who are using sex as a way of not losing. It's a form of dependency or needing in some ways. And, what's happening, it's so interesting to look at the data on pornography, because what happens with pornography is it goes way up around 1 a.m. So what seems to be happening is even if they're having sex with a partner, it's not very enjoyable. And so they're going to pornography at 1 o'clock in the morning in order to meet some other need, whatever that is. And I think, as we all suspect, people are starting pornography at the ages of 7, 8, 9, 10, 11. And what's happening is they're hardwiring into their brain images, and tolerance begins to develop. And in those images, they get bored. And so they have to do something more funky or kinky. And so they begin to hardwire into the brain more and more stimulation, tolerance, in order to get aroused. So endemic in our culture now are people who, when they go into a committed relationship, the image that's in their mind that is arousing them is more of a pornographic image where they are an object and their partner is an object. And when they have the real person who's touching and close to them and intimate, they actually are terrified unconsciously and don't even know it. And so they have to use the pornography to bypass true intimacy and to get sexually aroused. And so we have a whole population of people who I call bypassers, because they're having sex with their imagery, but not with the partner they're with. And so in many ways, what's going on in the bedroom is only a barometer of the capacity for intimacy outside the bedroom. And I think we have a whole epidemic of people who have intimacy problems. Okay, so where I go to is Peter Fonagy, who has many texts out. And their basic philosophy is that we have to look at the development of the self. And when you think of self as a superordinate structure, if you don't have a self, what happens is that the false self is looking for another false self. So what do we do to feed the development of the real self? That's something that analysts have looked at for long periods of time, including Fonagy. But And these days, they've done is they've brought attachment theory into the development of self, which is far more sophisticated. And so what we're looking at with self are representational internal systems. So Bowlby talked about internal working models, representational models. And that's the language I want to talk to you about today, because I'm suggesting to you that the internal working model for intimacy is injured, and that what our job is to build in an internal working model of what is a romantic attachment. So the fundamentals is, who am I? There has to be an I before there's a we. Self-esteem, which is my sense of self a defective one or in some way a healthy one? Self-agency, which is I am competent, capable, can operate in the world. Now, in that literature, it's so basic, there has to be safety before there can be exploration. Think about the infant. There has to be safety before there can be exploration. If there's not safety, person doesn't feel safe in close relationships and does not feel competent in the outside world. And those are the two defective injuries. So our job, I call it mission impossible, is to build the development of the self to facilitate self-esteem, to create self-agency, and then to get an image of self in relation with a romantic partner, and that you can envision yourself in a healthy romantic relationship with another person. In other words, you have a template in your mind of yourself in relationship in a secure way with another. So many of the clients come in and they say, I don't trust myself dating because I always pick partners who are destructive. What can I do to pick partners who are not destructive? And I think, have had very poor answers to that. The codependency books and such, they hit it, but they don't really talk about how to change the template internally for creating in the mind the capacity for healthy attachment. So here's what I want to suggest. There are what we call organized states of mind and disorganized states of mind. An organized state of mind allows you to be able to get into a healthy relationship with another. A disorganized state of mind means that you're going to continually pick destructive partners, one divorce after the other. So what I want to talk about is, how do you create an organized state of mind? Okay. Most of our clients come in and they feel like they're imposters. They don't know who they are. They don't know what their values are. They don't have a spiritual base, and they feel like they're hollow, alone, even when with people, and feel disconnected. And they turn to the therapist to see the development of the real self. And sometimes if you have a healthy therapist, you can facilitate that process, which is basic psychodynamic theory. And so a lot of the contemporary understanding of this, it was called metacognitive therapy. And metacognitive therapy is that you use the therapist as a secure base to begin to develop an organized state of mind. And that is something we all are aware of, but I want to enlarge upon that and talk about what we can do to not take 2 years of once a week therapy to begin to see the development of the real self, but to do it in a time limited kind of model. Now, the other piece of this is to borrow from Jeffrey Young's work on schema therapy, that what we're talking about when we talk about self-esteem is not like, we're going to do cognitive behavioral therapy or acceptance and commitment therapy, where we're going to have the person challenge their self-beliefs. But that to understand, these are schemas that are affectively written in the deep structures of the brain. So we're not talking about the prefrontal cortex. What we're talking about are affect-based therapies. So affect accelerated psychotherapy, internal family systems therapy, Gestalt therapy, the expressive therapies are oriented towards bringing affect into the room and beginning to work with the affective system. When the client says, I don't know how to love, and I don't think I'm capable of loving even my own children. What they're saying is, I don't even know how to express emotions. I don't know what an emotion is. When I talk about feeling mad, sad, alone, I'm talking from my head, not from my heart. And we all know the difference between that. So when they're talking from their head, that's prefrontal cortex stuff. When they're talking from their heart, that's deep structure, limbic, amygdala, cingulate gyrus, etc. And what we're trying to do in the 50-minute hour is bring the deep structures of affect online and work in the affective system, because that's where the low self-esteem is. And so where we've learned to do this most effectively is in trauma therapy, because in trauma therapy, what we're doing is we're activating the deep structures of affect where a person began to believe that they're defective and bad, and beginning to have the self challenge those deep structures. So using internal family systems as a model, what one does is one accesses the ego state of the injured self, brings it into the room, and then has the self of the individual begin to correct that with the facilitation of the primary therapist. So there are three in the room. There's the injured self, there's the adult self, and then there's the therapist as a catalyst to that internal process. And what we're doing is we're correcting this injury internally. And in that, we're finding that it's possible to change the schemas of defectiveness. Jeffrey Young has a similar kind of model in schema therapy, where he's beginning to work on the deep structures and change the core schemas that then, if you feel like you're defective, the rest of your life becomes a self-fulfilling prophecy of trying to prove everybody by sabotaging your successes and your competencies and so on, and proving to everybody that you really are bad, defective, injured, all that core kind of stuff. So anything that doesn't really get to these core schemas are probably the person's going to relapse. Now, another model of looking at this is that we all are influenced by our parents. And so we do what our parents model, and the unconscious is sort of swallowing in so much of what you're observing in each of your parents and your parents' relationship. This is one of my clients who said to me, to her own mother, she says, there's a big part of me, and now I'm struggling to get rid of it. It's like exercising a demon, except the you and me is an implosion of blackness more than an explosion of rage. When your personality surfaces me, I become punitive, paranoid, critical, and blaming. Now, you can read the rest of this yourself, but so many of the young women that I work with find themselves slowly becoming more and more like their mothers. And they develop some of the characteristics of the mothers that they dislike, as well as the ones that they like. And so in this, I become sort of intrigued with sort of back to the attachment model. A part of them is preoccupied, which we call type A, and part of them is avoidant, which we call type C. And so by incorporating what they saw with their parents, approach avoidance, fighting all the time every night, but not splitting, incorporates sort of a repetition compulsion of the unfinished business there. And all this sort of looks at this idea that there's kind of a template for sexual arousal that gets written in that includes both the A pattern and the C pattern, that somehow their sexual arousal is similarly. And so what happens is they get close, but then they have to pull away. They pull away with pornography, they pull away with affairs, and when they fear of losing the individual, suddenly they get very aroused. So one of the most interesting paradoxes about sexual addiction is that the person who's hypersexual is also hyposexual. They can be hypersexual in the sense of having affairs or going online or going to pornography at 1 o'clock in the morning, but they're hyposexual with their partner. And it's such a mystery to them. How can you be both hypersexual and hyposexual? But the same thing is true with eating disorder. The anorexic oftentimes binges, and the binge eater diets. And so hypo and hyper are two sides of the same coin and are really related to intimacy disorder. Okay, so where we are with this then is the model that I'd like to have you think about is the model of structural dissociation. Structural dissociation means that when there is a disorganized attachment, which means an approach and avoidance, that what occurs internally in the mind is a splitting off of parts of self. So you have one part who can be the seductress and wants to use sex in order to get people to want you. So in this, you have this sort of idea of beauty, but you have the dead eyes that are there. And so the person uses their body to seduce. So many of clients that I work with, they're hypersexual during the dating stage when the seductress is out. But as soon as they get into a committed relationship, they lose their interest in sex. And it's utterly surprising to them until you understand that there's a difference in ego states. The seductress part is an ego state, which is totally different than what happens when you get in a committed relationship. The child begins to say, I want a daddy in this case. And the child says, but sex with daddies is yucky. And so you have two separate ego states that are there. Now, what's the problem? You don't want the seductress in the bedroom, and you don't want the child part in the bedroom. What you want is the adult part in the bedroom. But what is the adult part? When you begin to work with this person, you have the woman in your room. Here's what she says. I don't know who I am. I don't know what I think or feel or want. And so when a person says to me, where do you want to go to dinner? I don't have an opinion. When they say to me, what do I want to do career-wise? I don't really know. When they say, what do I think? I'm not sure what I think. And so you have this person who's really poorly differentiated, almost stuck at a pre-adolescent level. And they're now asked to be able to make decisions. So you don't have an I until you'll be able to get a we. Now, a lot of people say, well, let's put her into individual therapy for 2 years. But what are you going to do with the relationship in the meantime? What I hope for is this, that instead of individual therapy or couples therapy, that there is what I think of as simultaneous, which means that you have to work with the individual, but you also have to work with the relationship. And so the first step when you have the individual is to help them begin to get a pattern of sense of self that's differentiated enough to pick a healthy partner. Because if you have a partner who has secure attachment, it's probably the most important thing that can happen to help the individual have secure attachment. But if a person who has insecure attachment finds someone else who has insecure attachment, it's really hard to work with them. So stage one is there has to be an I, individual work. Stage two, when they find a partner, that the partner has secure attachment, and you can use the relationship as a vehicle to allow the individual to be able to differentiate even more. What I think a healthy relationship is to help a person become themselves. And so when somebody loves you and you can receive that love, it allows you to become the person you were born to be. And that's what a healthy love is. What unhealthy love is that you get in the relationship and the person's a vampire and they don't want you to differentiate. They don't want you to have a core sense of self. They don't want you to have opinions. They want to control you, dominate you, and get you to be like them because they're so insecure that if you have some individuation, it scares the shit out of them and they have to somehow crush it in some way. So what you're looking for in your mind is a partner who loves the fact that you think on your feet, that you're competent, you're capable, that you have esteem and isn't threatened by it. Now, I guess all this stuff is pretty much cliche, but the truth is that these cliches are the fundamental of what the therapist is trying to somehow create in the mind of the individual. And so my point in this slide is simply to be able to say that by understanding ego states and understanding the phenomena of structural dissociation, where we've advanced to is learning how to be able to process ego states and help them be able to integrate. So almost good therapists are recognizing that what therapy is about is integration of split off parts of self, psychodynamic, of parts of self that have become separate in some way, and to identify these separate ego states. So with sexual addiction or sexual compulsivity, you have the part that's acting out, and that part acting out is, what we call the protector, and keeping the person safe so that these injured parts don't get hurt or abandoned in some ways. And so the best way to do that is don't get close. That way you can't get hurt. The problem with that is that then you end up spending your life alone, and that isn't any solution at all. So we call these failed protectors because they're protecting by keeping you stuck in a closet alone because they're so terrified of intimacy. So you have to begin to work with these failed protectors and help them be able to see that in the past, when they got close, they got hurt. But in the present, it's possible to create a healthy, secure attachment. Now, in this internal working model, I return to John Money's idea of vandalized love maps. And I've always loved Money's concept that it's a template in the mind that depicts the idealized lover and the idealized program of sexual erotic activity. And, I worked with John Money for years and, was ingrained in this in my belief system. But the question was, how do you change somebody's love map? In the early days, I worked with sex offenders. And how do you take a pedophile and help them have a love map of an adult relationship? Because in that case, you have an extreme case of a dissociated part of self that is a child part that is trying to get aroused by another child part. And how do you fix a pedophile so that they have an adult love map? Well, it turns out that a lot of what I learned from working with sex offenders applies to what we're talking about today, which is how do you change the love map? Now, I'm going to do something. I'm going to jump to a later slide, 41. Okay. Now, in this love map, Dan Brown and David Elliott have in their book on adult attachment this incredible idea, which is, Dan was sort of projective analytic work in hypnosis. And he developed this idea with David that what one can do is change one's love map and to work on the mind and implant an internal working model of secure attachment with self and of potential with partner. So in this mindfulness exercise, what they suggest is, they have a person do trance work and oftentimes do deep relaxation or even induction. And imagine yourself in a healthy relationship. Picture yourself able to ask for help, for advice. Imagine a scene which you're able to run to another person when you're in need. Imagine that you're finding a person, someone you can depend upon, who's got your back, who's loyal. You can feel what it's like to know this partner. And imagine that felt sense of feeling safe in your body with them. Imagine a partner who cares about you as much as you care about them. Imagine, and so on. And what you do is you work with that imagery and you develop it, not in one session, but many sessions, until you can begin to have the person have an internal working model of a love map of a secure attachment with a romantic partner. Now, the reason I love this thought is because when Money gave this template of a love map, there was never the formula for what you do as a therapist to help the person have the state of mind internally. Because if you've never seen a healthy relationship, how the hell are you supposed to establish one? And how many clients have seen a healthy relationship sometime in their life? That image is, the Joneses down the street had a healthy relationship until they got divorced. And it's like, can you ever believe that anybody has a healthy relationship or a healthy family? It does exist, but what I'm saying is that most people have literally no capacity to even imagine what that is. Now, my idea is you get what you accept and expect in a relationship. if you accept an unhealthy relationship, then you're going to have one. If you expect an unhealthy relationship, and since none of us know what a healthy relationship is in our internal working models, we end up creating and recreating the reenactment of a destructive relationship that we saw with the family of origin. And so in this idea of mindfulness exercises, we can begin to implant the internal working model of a healthy self with healthy self-esteem, with healthy self-agency, and with a lover who's able to recognize that in some deep structure kind of way. So this is sort of what I'm working on with David Elliott, and trying to understand more about how one works with these internal working models in order to be able to establish that. And the work is called the Ideal Parent work, LOVEMAPS. If you have what I'm calling a healthy love map, then it seems to me that pornography is going to seem relatively vulgar. I sometimes will kind of go on pornography websites and just sort of see what my clients are looking at. And something inside of me that sort of, wants to push away from it because it just seems so unnatural. I went to Thailand recently, and I got off the plane, and there were prostitutes all over the streets sort of seducing. And I felt so extremely uncomfortable that I decided to just go to the airport and get the hell out of there. Because each time I would see one, I would get the reflection of one of my clients that I'm working with who'd been raped and molested as a child, and looking at that, and the empathy that I felt was sort of off the scale. I didn't know I would feel that way until I experienced it. But in it, I began to really understand what it is that I'm trying to do when I'm working with sex addiction, which is I want the person to have the capacity for empathy and to begin to look at this and be able to feel a sense of sadness. I mean, you can see her dead eyes. You can see his dead eyes. There's an emptiness and a hollowness and a kind of a disconnection. And it makes me sad when I look at this. It doesn't make me aroused. And I think I have to create that in the client in order to be successful. So when I'm working with sex addiction, I find the most important ingredient is developing empathy. And empathy means that you can feel other people's pain. And when you see something like this, it evokes the little girl inside or the little boy inside and the pain that must be involved in this in some way. So if you can't feel, then you can't feel empathy. And if you can't feel, then you can't feel love. Empathy and love go together in some way. And so what is it that we do that helps a person begin to develop the deep structure for emotions and feeling? Well, the answer to that is obvious, which is in trauma work, what you find is that the structural dissociation, the parts that split off primarily because of trauma. And one part knows and feels what another part doesn't know and feel. And so as you begin to bring in consciousness, that which is unconscious, what happens is the ego states begin to integrate. Doesn't mean that they don't stay separate, but they begin to exchange information and feelings, and that's integration. And when that happens, there's trauma resolution. As there's trauma resolution, there's internal integration, and you can begin to feel your own pain. And so what I'm saying is that in order to feel empathy, you have to feel empathy for self. And you have to find the injured parts of you and begin to feel true compassion for the injured parts of you. And that then wakes up your capacity to feel empathy, so that in this situation, instead of feeling aroused, you feel sad. Now, in many ways, I think sex addiction and romance addiction are kind of overlapping. With romance addiction, if we look at the pornography sites, people are aroused by, having sex with your stepmother, or, daddy having sex with the babysitter, or doing something illicit in some way, that heart begins to beat in some way. Because we have people who are empty and hollow and numb, and they'll do anything in order to get a little bit of a heartbeat in some way. Well, the same thing with romance, that people want to be addicted to romance. I went out on a date one time when I was young, and the partner said to me something like, don't get too excited by me, because men oftentimes fall in love with me and then I break their heart. But I don't like to stick around. And I thought to myself, ooh, that's interesting. So what happens is that if I can capture somebody, they want me, I want to be able to, come in and then go out. Dr. Masters used to say, it's sort of like the old movies where the Indians would come in with their arrows and strike somebody and then go back out again, go in and go back out again. That so much with romance addiction is you come in for a minute or two and then you go out again. And it's the somebody wanting you that is so exciting, but you quickly go to boredom and emptiness. And marriages are like that. In the old days, it would be, if you won't have sex with me, I'll marry you. Then you can have sex together. And then quickly thereafter, the passion would leave the relationship. So how does one keep passion in a relationship? The answer is there has to be empathy. There has to be intimacy. There has to be love. And that empathy comes from passion. And passion is not just about romance, not just about sex, not just about love. Passion is about life. It's that ability to feel a sense of exuberance about it's a beautiful day, there's a beautiful tree, a beautiful flower, there's beautiful interest, that exuberance about life in general. And so usually what we're working with people who have dead eyes is they call it depression, but it's more than depression. It's an emptiness inside where they're unable to feel passion about much of anything and nothing. So we expect to give them an antidepressant, and to give them an antidepressant, somehow they're going to begin to get antidepressed. And it always seems to me silly to think about an antidepressant fixing depression when a person has no capacity for passion. And so what we're trying to wake up in the addict is not turning to an object, not turning to a chemical, not turning to stuff, not turning to work in order to get excitement, but excitement coming from the exuberance and the passion of life and living, of waking up in the morning, looking forward to the day and to the experiences in some way. And so what I'm saying to you is that part of what I do with the client who is the addict, chemical dependency, marijuana addict, or even the sex addict or the eating disorder addict, is it's not enough to get them sober. What one has to do once they create sober is to begin to wake up their ability to create passion in their life on a day-by-day basis and find out what's blocking them from being able to feel. Because if you can't feel love, if you can't feel sad, if you can't feel lonely, you can't feel angry, then you also can't feel joy, happiness, and so on. And so much of basic psychotherapy is getting people to welcome suffering, because with suffering is the capacity to experience joy. And so, I borrow from the Buddhist kinds of philosophies of beginning to understand that one has to not avoid pain, because the cost of that is avoiding pleasure. And so in that, what you do when you're doing trauma work is you're inviting them to go back and walk through the agony and the pain of their life with one foot in the present and one foot in the past, and process those events through their fresh eyes. And in doing that, to feel and to cry and cry and cry and deal with the losses and the grief as a requisite for being able to enjoy the passion. Anybody who's not permitted themselves to grieve is also not permitting themselves to experience joy. So I guess what you're getting so far is my point, which is that when we try to deal with addictions out of a holistic model of beginning to work with the individual, Marsha Linehan said, we're not trying to work on the symptom. What we're trying to do is help a person create a life worth living. And when she said that, it was so refreshing, because so many of the evidence-based treatments are beginning to treat the symptom. I once sat down with Bessel van der Kolk and I said, Bessel, somehow when you're lecturing that you are putting out the idea that we can treat PTSD effectively and that is treatment. But treating PTSD is only one step in treatment. That what one has to do once they're able to get remission of the PTSD symptoms is the developmental piece of beginning to help the person launch and become an adult, and then begin to learn how to be an adult. Because, when you haven't had experiences of a 5-year-old or a 10-year-old or a 15-year-old, there's so much you don't know how to do and you're terrified of in the world itself. And so in developmental psychopathology, what you realize is these kids who have been homeschooled and haven't socialized in the school system, or haven't learned to explore their environment and have anxiety that comes developmentally from mastering things that are really overwhelming, are then thrown into adulthood. And it's like being thrown out of an airplane without a parachute. You don't really have the capacity to operate in the real world, and you're scared all the time and alone all the time. And so one has to, in a developmental model, understand that parts of self have got stuck at 6 and at 10 and at 12. And a lot of that has to do with exploring the environment. So the model that I'm suggesting to you is the first step in therapy is safety. The second step in therapy is exploring. And in that comes the development of the real self. So this kind of therapy, a developmentally based therapy, has now been categorized as metacognitional. And it's worthy of just spending a little bit of time to talk about this, because if you can understand metacognitional, then the whole model of psychotherapy changes. And what metacognitional means is the ability to observe oneself. And so, for example, if I'm in a group of people and I feel like I'm defective and other people are nice to me, there's no way to receive their niceness, because I'm going to reflect it back because I feel like I'm defective. And if I'm with a group of people, I'm going to anticipate that they're going to reject me and abandon me and hurt me, and therefore I'm not going to allow it to come in. So receiving love means that you have to have a clear, objective concept of self that is not sort of eclipsed by shame, and an ability to see that other people don't see you like you see yourself, which is an egocentric model. Let me repeat that. Other people are not perceiving you like you perceive yourself. And so when I walk in the room and I feel like I'm stupid, then I assume if I say the wrong thing that you're going to think I'm stupid. And therefore I'm going to be incredibly anxious, monitoring myself, wondering what you think of me, and assuming you're going to think I'm stupid, and then creating a self-fulfilling prophecy. So the key of internal working models and relationship is to begin to have a much more clear sense of self and of others. And that's metacognitional therapy. And we're going to talk about how to do that. Now, I'm back to understanding what is love. And, one of my favorite definitions comes from The Road Less Traveled and Scott Peck, which is love is the will to extend oneself for the purpose of nurturing one's own growth and another's spiritual growth. Love is as love does. Love is an act of will, naming both intention and action. Now, what I think of that is the word will jumps out to me, because love is a verb. And in that, our capacity to love others is a component. And then there's will, which is the action metacognitionally of beginning to challenge these ideas of self as defective and other people's perception of it. That is will in the way that Scott Peck is talking about it. So he says, we do not have to love, we choose to love. And in that, it becomes the internal working model that love is a developmental achievement. Our capacity to love increases with age and growth. And the purpose of our life is to love, and the purpose of our life is to feed our capacity to love so that it grows. Now, in that, there is this idea of what calls a relational episode. And Liborsky wrote a book called Countertransference. And he showed through empirical research that everyone has a core relational conflict coming from their family of origin. And what he said was pick 10 narratives about a relational episode between you and another, and look at what it is that you needed, what the response of others were, and then how you responded to that. So for example, when I did this for myself, in one of the relational episodes, I was giving a lecture, and I noticed that a person was really angry in the audience of 100, and I kept focusing on the one person who was angry. And it was clear to me that my preoccupied attachment was getting activated. So the wish was a wish to be able to have everyone approve of me. The response of other was one person disapproved of me. And how did I respond to that? I took an hour and a half over lunch, and I obsessed over making my lecture even better so that people would like it, because I needed 100% of people to like it, not 99. And so in that, I could begin to understand my core relational conflict, which is rather obvious. Now, by bringing that unconscious narrative into consciousness, I realized that most of my relationships with people duplicated my core relational conflict. And that's what Liborsky showed. So the idea then is that all of us have these core relational conflicts, whether with our bosses, with our lover, and with our friends. And that when we're talking about romantic attachments here, we're actually talking about all of our interpersonal relationships. And so it's worthy of looking at this idea of core relational conflict and helping your client begin to identify that. And if you just Google Liborsky's work on core relational conflict, you'll get some of this. Then the whole idea of the imago. And in the imago work that was done by Hendrix's, what they showed empirically was that our images of the ideal partner of what we're looking for come from an unconscious where we pick partners who remind us of the best and the worst of our caretakers. So if you can take the people who took care of us, our grandmother, our mother, our father, whoever, our next door neighbor, and we take their best characteristics and the worst characteristics and name 3 of them, it will then begin to anticipate the kind of problems we're going to have on our romantic attachments. And empirically, it was incredibly predictive. And so this imago became something important. Now, why do I emphasize that? Because I said to you that one of the most important things is beginning to help shape the person's choice of a partner. If you pick a partner that is a reenactment and repetition of the negative aspects of your family of origin, you're just going to recreate one hell of a mess. And so what we have to do is do some work on teaching the person to have a perception of self and others, but to begin to see in this metacognition what we're recreating in our core relational conflict, or imago in some ways. And these are relatively empirical ways of doing that. Now, I said that we have to do what's called earned secure attachment with self and with others. And what the hell is earned secure attachment, you're asking? Where does it come from? Well, it's taken from Mary Main and Hesse. And Mary Main developed the adult attachment interview, which probably most of you are aware of. I got trained in the adult attachment interview, and of course, it really changed the way I did metacognitional work. So in it, what we're doing in earned secure attachment is establishing metacognition. And I'm going to tell you how we do that in a minute. What we're looking at are idealizations and loyalties. So here's what I want to say to you, that the number one block to secure attachment is loyalty to the family. And the number one thing that has to change as we're working with the sex addict or the intimacy addict or the romantic addict is beginning to change their internal working model of the family of origin. So let's go to the next slide and talk about how to do that. What Mary Main taught us was to watch the narrative coherence. So now we're moving to a narrative therapy model. And instead of listening to the content of the individual story, because we always look at our pastor with rose-colored glasses, what she looked at was the structure of the story, what the person allows themselves to know and feel and remember in the story. And what she said was that she looked at the way they used language and breaks in the story, disruptions, inconsistencies, lapses, irrelevancies. And what she would do is she'd tape the interview, and each line of the interview she would analyze both at the content level for loving and unloving, but on the process side of ways that they used language that suggested disorganized attachment. People with disorganized attachment have very clear narratives. They don't finish the sentence. They put at the end of the sentence, oh, you know what I mean. Or they, at the end of a sentence, will go on and talk and talk. So, for example, with preoccupied attachment, you may get one sentence that's 2 pages long. With avoidant attachment, you get this individual who answers everything short. Tell me a little bit about your mother growing up. Oh, she was really a good mother. End of story. That's avoidant attachment. So you can diagnose and assess people really quickly by looking at the sentence structure of how they answer your questions. And of course, she did what she called surprising the unconscious by saying, give me 3 adjectives to describe your relationship with each of the parents that took care of you or each of your caregivers, and then took a story about each of them and analyzed each of those stories. Now, what she recognized in her work, which then applies to us clinically, was that of what we do in therapy, the most important ingredient is coherence. Metacognition means that there's coherence in the way the person uses language, because the language represents the internal working model. And a person who has an incoherent internal working model does not have an organized state of mind, and therefore is going to have issues with intimacy. So what is coherence? It means that events from your life flow. And so if you feel like you're defective, you know exactly what happened to you. You weren't born feeling like you were defective. There's a set of logical, rational things that happen to you, i.e. trauma model, developmentally, that contributed to this feeling like you're defective in some way. And so what good psychotherapy is always a flow of looking at the output in relation to the input. So a person comes into me and says, last night I masturbated to imagining myself having sex with a prostitute. They weren't born with imagery of having sex with a prostitute. Their love map didn't develop in that way at birth. Something happened to them developmentally where the output, and so what we do is we follow the output back to the input. And the way we do that is in the BAS model: behavior, affect, sensation, knowledge. Each of those become dissociated. We have a behavior, which is masturbating to prostitutes. We have affect, which is sexual arousal to deviant kinds of input. Sensations, the body gets programmed to turn on to illicit kinds of things. And knowledge, all of those dissociated in some way. And that result of that is what we begin to see with structural dissociation as the output. So our job is to develop a coherent state of mind of understanding the output in relationship to the input. Coherence then is you have people begin to do a timeline of thoughts, feelings, and actions and events that occurred in their life. Now, is there true memory or false memory? Okay, memory is not reliable. What's important is how a person perceives the events in their life, thoughts, feelings, and behavior. And the way they perceive it turns out to be related to their schema and what they've created in their life. So an organized state of mind with metacognition, you become curious about how you came to be aroused by pornography, and you take the output and you follow it to the input. And so a person can come in, they say, I'm really angry at you as the therapist. And the anger at me as the therapist is not just seen as resistance, it's seen as a gift, because that resistance allows you to begin to understand something about the person's state of mind. And it may be that they have avoidant attachment. When you try to get close to them, it just makes them angry. Now, when I use the ideal parent paradigm and I have them begin to imagine a parent who was really healthy and loving, oftentimes the person experiences intense anger in relation to that. And it's so diagnostic because you can see the person avoiding in some deep kind of way the idea of even imagining a healthy relationship with a parent. And it begins to pop the cork of the blocks to intimacy. So narrative therapy then has something to do with having the person write out their cohesive narrative and to begin to put it in some organized way and make it known to others. And in it, we are going to begin to contextualize and look at the conclusions, the schemas that the person made and relationship to the input, and have them begin to challenge that. So it's not that I don't do DBT or acceptance and commitment therapy. I love those kinds of models of challenging belief systems, but I do it in a much more metacognitional way. And I don't want it just to be a cognitive experience. I want it to be a cognitive affective experience. And in the acceptance and commitment therapy paradigm, it was always an affect model. And in that model, it wasn't just cognitive behavioral therapy, it was cognitive affective behavioral therapy. And it was beginning to do and challenge the deep structures and begin to develop the values. So if you study acceptance and commitment therapy, it's a really beautiful model. So in our treatment, what we do is we have people come in usually for 2 to 3 months. We see them 3 times a week. And in their 6-hour day of partial hospitalization, they do individual therapy where, let's say, I'm working on the metacognition stuff. But then in the groups, they're highly targeted. We have an attachment group, we have an acceptance and commitment therapy group, we have a DBT group. We have really targeted groups that are oriented to beginning to change some of these schemas and deep structures. So I've alluded to what's called the organized state of mind. And what I'm suggesting to you is that in order to have secure attachment, earn secure attachment, in order to have healthy intimacy, in order to be able to love, in order to be able to receive love, that one prerequisite is having an organized state of mind. And you have to diagnose the disorganized state of mind to know how to target an organized state of mind. So in Mary Main's idea, an organized state of mind means there's coherence in the transcript, that 2 and 2 always equals 4. There's metacognitive monitoring, that when you feel shame, you become curious about the origins of that feeling. That there's, when a person is dismissing styles, what they end up doing is avoid. And the way they avoid oftentimes is idealizing the parent. And so whenever anybody talks badly, maybe your parents were abusing you, maybe they were neglecting you in some way, it elicits a feeling of defensiveness and even anger or rage. And somehow a person's really uncomfortable with that because it elicits a sense of loyalty. And so the most common sex addict presentation is, my parents were really terrific, they really loved me, and they really did a great job. And then when you start pulling up the blinds a little bit, they never talk to their mother about anything real. Everything is superficial. There's no real conversation that ever occurred. And you never know anything about your parents' history or background because you never bothered to ask. That is an avoidant style. On the preoccupied end, it's like the person comes in and they're furious at their parent, or they're overbonded with their parent, or their whole life is dedicated to trying to get someone to adore them and love them in the way that their parent didn't. And so the preoccupation is that they find themselves a victim, whining and moaning and being in misery all the time, depressed, and looking for someone, to love them and care for them. And they pass that on to the therapist. And so what happens is there's emotional kind of turmoil between them and the therapist in that therapeutic relationship, because there's please love me, but I don't want to get close to you, because if I do, I know you hurt, abandon me like everybody else. Then you find out how defective I am. So a lot of the preoccupied patterns worked out in the therapeutic relationship, no small thing. But it's also important to have the person be able to observe themselves and see how their relationships are just simply reenactments and repetitions of the unfinished business in the family of origin. So the things you're looking for in your therapeutic relationship is idealization, inability to recall. Some people they don't remember anything in the first 10 or 15 years of their life, and they have complete amnesia. And that's always a sign of disorganized attachment. It's all in there, and it comes back slowly in the therapeutic process. But the amnesia seems to be associated with terror or fear. There's a lot of data from animal work where if you shock the hell out of a rat, they lose their memory of the maze. And what that means is that trauma tends to affect the hippocampus and the whole consolidation of memory. And so people who have severe trauma or neglect oftentimes have huge inability to recall. And that's a sign of a disorganized state of mind. And, the avoidant is a very contemptuous and cool and will push you away. So, the first stage of working with the sex addict is, why are you asking that question? Why do you want to know? Why is that important? How does that relate? And so, a lot of people I see who are in 12-step groups, who are what I call dry drunk, they're really unable or unwilling to go to a therapist because they think they've already succeeded. But what they've done is they've got into the first stage of therapy, which is learning how to be able to be sober. But sobriety isn't a cure. Sobriety is just the first step in therapy, which then allows you to go deeper and to look at the origins developmentally of your incapacity for intimacy. So I think sometimes by becoming sober from sex addiction, you're sentencing a person to a life of aloneness. And the second stage is beginning to really look in depth at the trauma or neglect in their lives that have blocked them from being able to love and be loved. And that's the ultimate cure. So in this idea of coherence, which I brought up, it's basically a unified, free-flowing picture of experiences and ability. And what you're able to do is that there's some coherent consistency in the transcript. And things begin to make sense to both you and to the individual. And so you weren't born this way. There are certain events that happen and we make meaning and sense. The people at Menninger call this plain old psychotherapy. And that's such a beautiful description, plain old psychotherapy. In plain old psychotherapy, what you were doing was beginning to help the person make sense of from whence they came and the input and the output. But the difference here is that what you're doing with plain old psychotherapy is you're beginning to make it a science rather than something that's random. And in that science, you get better and better at fine-tuning the ability to develop coherence, and you get more effective in that whole process. So you're constantly helping the person begin to be more aware of their thought processes and beginning to look at internally what's going on. So oftentimes what I do is, after I'm working with the individual, I might bring their partner into the therapy. And when their partner comes in, oftentimes there's co-addiction. And so the partner can, as they begin to love and show the capacity to love, the partner gets very uncomfortable and will do certain things to push them away. And so the partner has to come in recovery too. And when you love somebody, it begins to help them begin to love you back. Systemically, when one person changes, the system changes. And so when you bring the co-addict in, what you're beginning to do is, as the person begins to allow themselves to be intimate, what they oftentimes will do is say, I'm going to hit you over the head with a pass. I'm going to not allow you to get close to me because I know you're going to leave me or abandon me in some way. And what's going on there? Well, the partner's terrified of intimacy. That's why they chose that partner in the first place. And so the idea then would be to begin to work with the co-addict and help them begin to say, wait a minute, I'm going to be able to allow the possibility of change here. And I'm not going to be terrified that the person's going to do the same thing they did in the past. How do you know that the partner's not going to hurt you? The answer is, it's really obvious. It's obvious because the partner becomes capable of loving you, of being intimate, capable of empathy. And so if you're having a bad day and you're hurting, the partner doesn't try to control you, try to yell at you, try to dominate you, get angry at you, but the partner feels compassion and caring and support and loving. And it's so obvious that you're able to say, wow, what's going on here? And that's why you feel safe with the partner. And as you feel safe with your partner, then it allows you to be able to separate and individuate, because you can't explore until you feel safe. And you can't feel safe until your partner's capable of loving and caring for you. So I always bring the partner in, and I always support the choice of a partner and helping a person develop a healthy relationship in some way. If the partner is unwilling or unable to join into the process, if they're wounded in their own way, but terrified because of their own trauma, then, hopefully you encourage them to go to their own individual psychotherapy and get to the point where they're really capable of working within the coupleship. My favorite kind of therapy is I do individual work with a partner in the room. And so what I tend to do is, if I can, is I may work with a man on his injuries, but I have the partner sitting there quietly witnessing what's going on. And then at the end of the session, I have them go out and have coffee and talk about the session. So all that energy that goes into opening up Pandora's box doesn't just go to the therapist, intimacy with the therapist, but also goes to the partner. And so it's a three-way street, which is he is forming intimacy with me, he's forming intimacy with her, she's forming intimacy with him, and she's beginning to trust me. So all those dyads are relatively intact when we're able to do that. Then oftentimes I'll work with the woman on some of her depth work with the male in the room. And as I'm able to help her begin to feel self-compassion, he's able to feel even more love towards her, and I catalyze a process there. That's my favorite kind of therapy, but it's sometimes hard to get them to come into the couples work for individual therapy. Okay, so we're talking about the metacognitive process. So there's something called the metacognitional assessment scale. Paul Lysensinger has that if you want to begin to reference it. And in it, it begins to delineate these domains of what is metacognitive kinds of things. And it's the ability to recognize one's own emotions, the ability to establish relations among separate components of mental states. The second domain is integrating. That in that integrating, you're able to say that the way I think about things is different than the way other people think about things. And here's how I came to think about them. Here's how they came to think about them. And you can begin to reconstruct that. And so you have greater empathy for your partner, understanding from whence they came. Differentiating, the ability to recognize one's individual thoughts and how you came to imagine, evaluate, and expect, is decentering. This is the one that I pay most attention to, which is to understand how others think of you. In a group therapy, I oftentimes will ask the person what they took out of the session, because what I find is that a lot of times they they basically project their beliefs onto the other people in the room, and they don't recognize that other people see and know things different than themselves. So when you are an adolescent, you are very narcissistic and you are stuck on how you believe things are. When you become an adult, when you become differentiated, when you become an independent, what you realize is the way you think is not the way other people think, or even the way they're supposed to think. And you respect other people's thinking as different and separate from your own, and you don't need to control them or hate them for thinking or feeling different than yourself. And that's what's called being an adult. All right, so where I'm heading then is that I know this sounds very theoretical, but by beginning to do this theoretical work, I can really look at what it is that I'm doing in the therapy process that's allowing the person to begin to have the development of the real self. And so what I'm doing is I'm beginning to understand at a much deeper level what it is that I do in the therapy process that allows the person to begin to transform and become the real self. And I emphasize the first step is safety. The second step is exploration. Safety in the therapist, in the relationship that we have. So often with avoidant attachment, I can feel the disconnection between me and the client. And I respect that. And a lot of times therapists get rambunctious and they want to, kind of come in and try to connect, particularly if you have a therapist who's preoccupied. They'll come into the avoidant client and they'll kind of pull them in too quickly and scare the shit out of the client. Be attuned in some way, recognizes with the avoidant client, it's going to take some time to develop a therapeutic relationship. And that safety in that therapeutic relationship is essential for anything else to happen. And so one has to be patient. That's why I like this model of working partial hospitalization, because oftentimes it can take a year in outpatient therapy to get a real relationship. And not much is going to happen until you have that. And who has that kind of time? So what I like is in my partial hospitalization, we are able to do that in a month and do a very deep kind of thing to get a real relationship. And then that real relationship allows the person to begin to individuate and explore and become an individual, so that when they go back to their partner, that their ego boundaries don't collapse and they can hold on to themselves when they get close. So what I'm trying to do is I'm trying to have an I and a we, and the I doesn't get dropped when we get into a we, and one can hold on to their I whenever they get into a we. And in that balanced I-we relationship, you have secure attachment. Now, I've alluded to the fact that we do trauma work. And in that trauma work, what leads our trauma work is dissociation. And what we're trying to do is look at separate ego states and begin to look at how these injured ego states can sort of drive the bus. In the acceptance and commitment therapy, they use the metaphor that the self has to be driving the bus and the parts have to be in the back of the bus. And so when self is driving the bus, you might have a part of you that comes in and says, oh, we need to have sex tonight. Oh, we need not to eat that food. Oh, we need to run away from this person. They're getting too close. Or I'm really scared. And when these parts come in, there is self-leadership. And so the one driving the bus is able to come in an empathetic way and not say, get lost, kid, but be able to listen to the kid and validate how they feel and what they think and help them understand it's okay to feel and think that way, but we're not going to let you drive the bus. What we're going to do is that was then, this is now, that was the past, this is the present. Back then, people hurt you. Back now, I'm going to protect you from people hurting you. And so what we're beginning to do in that dissociative process is have somebody who is an adult begin to be in charge. We all need an adult to be in charge. Otherwise, we're going to be scared all the time. So if the person is drinking alcohol, if they're cutting on themselves, if they're running out and slipping in the evenings, then it's not safe. And so they can't have an adult driving the bus. that means parts are coming in, hijacking the system and taking control and causing slips and relapses. So the first step in treatment is always sobriety. And the reason you want to be sober is not for your therapist, but for your parts inside don't trust you. And if they don't trust you, they're going to jump in and take control. So the first step in therapy is always sobriety and getting under control so that your parts can relax a little bit and let you drive the bus. And when that happens, then you're able to have yourselves notice when a part jumps in. So let's say I'm in a relationship and my partner is doing something that hurts my feelings. Let's say they're staying out until 1 o'clock in the morning drinking alcohol. And I'm really jealous and I'm really angry. Instead of beating them up, I work with my jealous part and I say, what's up? And the jealous part goes in and says, this is going to happen, this is going to happen, this is going to happen. And it's always based upon the past, meaning they're in a flashback. So I'm able then to talk to that part and be able to say, that was then, this is now, that was her, this is not her. And we're safe. And I'm going to protect us. And then the person driving the bus is going to say to the partner, when you go out to 1 o'clock in the morning and drink alcohol, I get scared and jealous. And can we talk about this and come up with some solution? Because I don't want to rain on your party. I want you to be able to have fun. I want you to be an adult. I don't want to ruin your having a good time, but I get scared when that happens. And so I need reassurance in some way. So the one driving the bus then begins to communicate in that kind of a way. But if you don't have a voice, if you can't really communicate, if you don't feel safe, you're unable to do that. So you see what I'm saying is that as we begin to understand the dissociative process, now let's apply that to sex for a minute. With sex, what happens is a part says, I'm really not turned on by my partner anymore. I want to go out and have sex with my coworker. And then you go in and you say, what's up? And the partner says, whatever. And you begin to understand the break in intimacy with your partner and what's going on there and begin to heal the real problem, which is the intimacy problem with your partner, not with your attraction. So your attraction to the person you go to work with is a sign that there is a problem in your primary relationship. And you're always looking for those kinds of signals. So mentalization-based therapy, we've talked about that already, but we're trying to improve theory of mind. What we're trying to do is have the person begin to notice in themselves disruption. So I just gave you the example. If I feel really angry and jealous, instead of beating up my partner, I'm able to mentalize and say, what's up, Mark? And to look at that and begin to do work upon themselves. And so in that, you begin to have a relationship with self and notice when you're having these disruptions of anger, jealousy, fear. And when that happens, you become curious about what's being reenacted or repeated from the past, and you work with yourself rather than trying to control your partner. Now, I've said to you that the first step in this process is always feeling safe. And so in Brown and Elliott's work, they do work on what they call the ideal parent paradigm. And what they do is they help a person begin to have an image of a safe, secure relation with an ideal parent. And in that process, what you're doing is you're helping the person begin to understand what a secure attachment really is, what a safe relationship really is. It's just like you don't know how to have a romantic relationship with another. If you don't know what safety is, if you don't know what it means to feel safe and secure inside, you can't really ever feel good with yourself. So the addictive personality, that sense of hole in the middle of your stomach, the hollowness inside of you, is always because you don't have a secure attachment with self. And so security is necessary for exploration. Safety is necessary for exploration. You can't feel secure and safe until you begin to have the ability to understand what you didn't have as a child. And so most of us are in denial and minimization as we idealize, and we think what we had as a child was secure attachment. when oftentimes it was not. And so we have to begin to have any frame of reference in our internal working model of what secure, safe attachment is to imagine beginning to have it with us. As you can imagine, it also changes the way you parent, because suddenly, what we do in parenting is we repeat so many of the disruptions in attachment with our family of origin and make the same mistakes. And so as you begin to love your partner, you also begin to love your children in a different kind of way. So in this self structure, you can begin to observe yourself. There's more coherence, there's continuity, and you're beginning to have more integrated. So in this, what you're doing is, in the self structure, is first having an integrated idea of self and others, and then you can begin to have some self-esteem and challenge your shame in some core kind of way. And as you begin to feel safe inside and have some self-esteem, then you begin to feel effective and powerful and feel some self-agency that you can operate in the world effectively. Third stage, and then romantic intimacy. So I want you to see it in a stage way: safety, security with self, self-esteem 2, then 3 is beginning to feel self-agency. I'm competent, capable, effective, and powerful, and then have a romantic attachment. And the first 3 are requisite for the 4th one. And each of those are sort of stages of the psychotherapy process. Okay, I'm at a point where I think it's probably a good time to stop and take some questions. What I've tried to say to you is that working with something like sex addiction or romantic addictions is really in stages. And the first stage is getting sobriety. And once there's sobriety, then beginning to do trauma work. And then third, beginning to look at the self structure and the shame. And then beginning to imagine oneself as having an internal secure attachment with self and safety, and then feeling like you're effective in going out and exploring your environment. And then you become an adult, have a real self, and 2 real selves together have, a capacity for intimacy, which is enduring. And in that structural kind of model, you can begin to look at the subset of where you get stuck in the process and what's necessary and what's sufficient. Because oftentimes the person thinks that they're capable of an intimate relationship, and actually they have not yet integrated, they have not yet differentiated, that they're still staying at almost a child adolescent kind of level, and they have a false self. And what we're really trying to do is see the development of the real self.
The first one that came in was, wouldn't romance addiction be associated with serial dating? Addicted to the fall, but not the commitment, and ultimately becomes abuser by abandoning the partner?
Yeah, that really kind of says it well. A lot of the women that I see, they're getting 100 people, 100 men a day trying to solicit them. And what their hobby is picking 1 or 2 when they get bored and having a coffee date with them, and then picking out what's wrong with them and then rejecting them in some ways. And so there are no good men out there, and they're constantly finding fault. What is that? It's preoccupied attachment. Preoccupied attachment is your life is about noticing what you didn't get. You're a professional victim. Nobody's going to love you right. Everyone's going to hurt you. All men are like dogs. All they want to do is have sex. And it's unfortunate. When you have that script, obviously computer dating is just a lesson of futility. And so one has to change the internal working model and sense of self before they're ready. And you know what, I think that mating is like magic. I think that once you feel securely attached with self, your partner's right around the corner. So when you say, I can't find a good partner, it's because it's an inside job. You got to work on your love map inside before you're going to find somebody on the outside. But as soon as you correct your love map in the inside, you're going to find the partner. They're right around the corner. How does that happen? It's pure magic. I don't know, but it does happen. And I've got 50 years of experience, and I'm saying that if you are unhappy with intimacy, do the inside work and then the outside will come.
Okay, I've got another question here. What attachment assessments are available and how do you utilize these to guide your work?
Oh, that's a good question. A lot of the attachment assessment devices are of the subtype that look at, kind of conscious mind stuff. So there's two schools of attachment. There's the Mary Main school, which is the adult attachment interview, and then there's the adult attachment assessments that are done, and there's a whole kind of 1,000 publications on that. And in those, I can give you copies of them. They look at people's attachment styles and so on. The school that I use is the Mary Main school, obviously. And in that, what I look at is the adult attachment interview. And it's to get trained in that is very complex, but you can learn in a couple hours how to be able to use the adult attachment interview as a clinician and to use it as a way of assessing. So with my staff, I always spend, a couple hours training them in the adult attachment interview and how to think about it and score it, not in a formal kind of way, but an informal kind of way. Because I think it's important to know the attachment style of your client before you start working with them. If they're more avoidant than they are preoccupied, they're more preoccupied than they're avoidant, and then the level of disorganization are really important. And the adult attachment interview is the gold standard there.
Do you think sex porn addiction is a precondition to not doing couples work? I won't work with couples with an active addiction because in my view, it's not a problem of the relationship or the couple. However, I do encourage the spouse to join the individual therapy session from time to time.
Yeah, what you say makes sense. But the problem is that while you're doing the individual therapy, the marriage is breaking up oftentimes. Or as you're doing the trauma work, there's no sex. And so what you're doing is you're enabling the relationship to slowly be injured. And so I don't like having these absolute rules. I apply it, to what I'm dealing with. And if the couple really want to maintain their relationship, I've got to do enough work on their communication and enough work on their problem solving and their anger management in order to hold the relationship cohesive enough for the individual to have time to be able to work. So it's what you say makes perfect sense, but it can't be an absolute from my point of view. I look at people as having intimacy and intimacy disorders. That in that we're using basic object relations and psychodynamic theory to look at the immature individual getting in with another immature individual and creating one hell of a mess. And what I want to do is I want to facilitate the differentiation process so there's a real self together with another real self. And until I get that, I feel like there's a high probability of relapse, either in terms of the marital or the sexual work that's being done. And when somebody has been unfaithful to their partner, i.e. had affairs or sex addiction or going online, it's really terrifying to go back, and you have every right to say, how can I feel safe in that relationship? And I only know that you can feel safe when that partner is able to feel true capacity to feel emotions, to feel empathy, and to love you in a healthy way. And that is not something that's subtle. Feel free to stay in touch. If you have ideas that you want to add or subtract, that's good. If you're looking for more training, I can send you in the directions. Obviously, Dan Siegel is terrific in his trainings on dissociation. Kathy Steele is terrific on structural dissociation. David Elliott is really good on the ideal parent. Dick Schwartz is obviously incredible with internal family systems. All of those are subsets of what I'm talking about today. Thank you all for coming. I really appreciate it, and I hope to get to know some of you in the future. Thank you.